Aloha, I'm Kikoa Kealoha. Before I teach you anything about navigating healthcare, I want you to know who I am and why this matters so much to me. This did not start as an idea to create a community or to share information. All of this started with frustration. And honestly, it started with moments of feeling completely overwhelmed. I felt frustrated with how complicated healthcare is, how confusing it can be, and how easy it is to feel like you're doing everything right and still not getting the care that you need. Over time, I realized something that really stayed with me. Most people aren't failing the system is failing them. So I was born in Honolulu and raised in North Kohala on Hawaii Island, which is a small, tight-knit community where you learn really early what it means to show up for people. And that's where I learned what care really looks like, not as some abstract concept, but as something you practice every single day. Later, I attended Kamehameha School's Kapalama, where my identity as a Kanaka Maoli grounded how I think about responsibility, community, and what it means to take care of one another. I eventually went on to study sociology with a focus on public health because I wanted to understand not just individual health, but the systems that actually shape it. For over a decade, I've been working in the HIV field. I've worked in outreach, testing, prevention, case management, and now I work in policy. So I've seen healthcare from all sides, on the ground and behind the scenes. And no matter where I was working, I kept seeing the same thing. People entering the healthcare system without a roadmap. Patients who didn't know what questions to ask, what their rights were, how to follow up, or what to do when something didn't feel right. Caregivers doing everything they could but still feeling unsure. And providers trying their best but working in systems that are rushed, fragmented, and not built for clarity. So things fall through the cracks. Care gets delayed, important details get missed, and people walk away feeling confused or even dismissed. And this isn't something that I've just seen professionally, it's something that I have actually lived. I've been diagnosed with atrial fibrillation, congestive heart failure, and type 2 diabetes. So I know what it feels like to sit on the other side of the system, not as a professional, but as a patient. I've had moments where I walked away from appointments thinking, I should have asked more. I didn't even know that was something I was supposed to keep track of, or even not realizing that I had another option. And those moments don't just disappear, they add up. They cost time, they cost money, and sometimes they affect your health in ways that could have been prevented. So I started asking myself a different question. What would it look like if people didn't have to guess their way through healthcare? What if there was a simple way to approach it, step by step? Not overwhelming, not filled with jargon, just something real and something usable. And that's where the Steps to Care comes from. It's a framework built around 4 simple actions: collect, ask, record, and escalate. They sound simple because they are, but when you actually use them, they change how you move through the system. So this space, whether you're watching this on YouTube or inside the school community, this is for you if you have ever felt unsure about what to do next. If you're a patient trying to understand what's happening, or a caregiver trying to support someone that you love, or someone who just wants to be better prepared, you don't need a medical background to navigate healthcare well, but you do need a little bit of structure. You need tools, and you need a way to think through things when it matters the most. So if you've ever felt confused or dismissed, or like you're just trying to figure it out as you go, you are not alone, and you're in the right place. I'm here to help you build that clarity, and I'll be here with you while you take the steps to care for yourself and for the people that you love.